Hey guys, I just wanted to shout out this season sponsor, Service Hero. Service Hero is an application and website based here in Kuwait, and what it allows people to do is to rate the businesses and services in Kuwait and in Dubai for whatever reason. So you can show some love, show some areas of improvement. In this way, kind of a win-win for both sides. The businesses can improve, and also the customer can kind of voice their opinion. This also extends to hospitals theme. So if you've gone to a private hospital, private clinic, and you want to show your love, be sure to rate them and take another step further. The coffee you're drinking right now with this episode, take a photo of it, rate it on Service Hero, and let us know what you think.
That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your guest host, Dr. Hashem Boalbanat, and joining me today is the infamous host, Dr. Aziz Khayyat. Aziz, thank you for being here and thanks for having me.
Pleasure to be on this side for once.
So, yeah, honestly, so today's episode is a special one. Before we actually introduce that topic, I would just want to thank the Hub for giving us this phenomenal coffee. As I told you previously,
Ching, ching.
I think we both need our coffees to settle down.
Yes.
It's our version of alcohol since we don't drink alcohol, basically. So today's topic is actually one of paramount influence. I hold dearly to my heart. I know you hold dearly to your heart. You're a massive advocate of mental health, and it's a massive topic that needs to be discussed at the kickstart and every single point of any physician or student's career or any healthcare providers.
Yep.
Today's topic is burnout. So before we dive deep into it, Aziz, you are one of the most inspirational people that I've honestly ever met. You juggle through so many things. In the hospital, you do your due diligence with the patients. I'm not saying that just as a friend, as a colleague, as a professional. I've seen you, we call you the doctor on steroids because you really are. You go the extra mile for every single patient. On top of that, you're juggling this whole massive project that's getting international recognition. And I know you have a lot of other side gigs. So Aziz, before I say anything, how are you not burnt out, my friend? How are you, honestly?
First, a thank you to that intro. I'm going to put that on loop for every morning. Just, I'm going to put some motivation music in the back. Instead of the meditation where you are enough, I'm just going to have Hashem's voice telling me.
Honestly, said nothing but the truth.
Thank you. I'm burnt out.
You are burnt out?
Yes.
Wait. Okay.
Yeah, and that's a big reason why we wanted to do this episode, and I felt like it's important for me to speak out at this moment because I can really talk about something I'm experiencing right now. Maybe in a year's time, I'm not going to remember it as well. So, and since this season is all about starting off your medical career, I think that it would be good to discuss this topic of burnout because I'm in it right now. So I can comment on it. You know what I mean?
100% agree with you. I think that is such an important topic. I remember in the US, like within a year, we'd get that topic 12 times. It gets headlines on the news. A couple of physicians, healthcare providers either quitting or committing suicide or going on antidepressants. It's such a massive topic that needs to be discussed. But before we do that, Aziz, let's talk about the definition of burnout. For me personally, I genuinely don't think there's one fit definition of burnout. Burnout can be interpreted in multiple different ways. I think we don't have a set definition that we can look back to and everyone is like, yep, I concur with this as a definition for burnout. So Aziz, tell me, what's your definition of burnout? How do you define it?
So the way that I like to define burnout, there's two approaches. You can always go the more textbook approach, as in the literature defines it as XYZ and you put in the variables that would define burnout. And then I looked at some of those definitions, when I was looking up burnout and doing my own reading about it. But then I think there's another element to defining burnout, which is why I'm here and why we're discussing on this podcast, is my personal experience with burnout. Because it's one thing, I think everybody is capable of Googling what is burnout, but it's another thing to hear about someone who is experiencing it, as well as taking in, the more formal definitions.
Yep.
So the way that I would best define burnout for me would be when, due to work professionally, okay, and work doesn't necessarily mean going and clocking into the office or in the hospital. It also means your work. So like if you run a business, being a parent, these are jobs. This is what you're occupying your day with, this is your main thing, right? When your work is causing you to feel fatigued, tired, and not able to do things, or if something requires more attention than it actually merits, or effort. The word is effort, not attention. So I'll give you an example. if sending out an email, let's quantify it. Let's say effort is by a numerical scale, and let's say effort is on a scale from 1 to 5.
Yep.
An email should be a 1. It's just an email.
Fair. That's true.
Send.
Yep.
If it suddenly feels like a 5 consistently every day for a period of time, you need to start thinking what's going on here. And for me, the thing that differentiates burnout from other forms of stress or depression, for example, the differentiator for me is where the root of your tiredness is. If it's coming from your work, that's where I think burnout it is the operative term. You know, let's be clear though. Burnout is very different to the pathology of depression.
Okay. How so?
So depression fits the DSM criteria, and there's a certain number of symptoms you need to have side caps. So
and just to hopefully shine the topic, is burnout an actual DSM-5 diagnosis right now?
At the moment, it is not.
Do you think it should be?
I
I know that's a good question. I know we're not yet in the position to talk about it.
That's actually a really interesting question, because what is pathology? There's a big debate in psychiatry about personality disorders. Personality disorders, some people argue, are not actual pathologies.
Oh, interesting.
They're variants in personality. They're just,
Interesting.
But when I asked a psychiatrist this question, his response stuck with me for my whole life. He said, personality disorder becomes a disorder at the point where it affects the functioning of the patient.
I see. And I completely think that's a brilliant answer.
So if we then argue, okay, can burnout be labeled as a diagnosis? Well, then it would impact the functioning of a person, which, like I said, it does.
Correct.
Right? The difficulty in pathologizing burnout is the implication of pathologizing it. So when you pathologize something, it has legal implications, because then, okay, if I'm burnt out for my job, does that then mean that my job is now legally responsible for my medical bills because they caused this upon me?
Enough. I see.
Medicine is multifaceted in this way. You need to look at things from a social angle and a legal angle, a psychological angle. And this is one of the ways, like, can we actually pathologize burnout? And then the next question is, aren't we all destined to burnout at some point?
Yeah, so that's exactly it. I genuinely think before I actually, the moment I saw burnout, I was like, isn't it the natural inclination for all human beings to be burnt out? I feel like life throws so many curveballs at you. Things emerge. You get into a car accident one day. You struggle with the bills. That's another day. And then you're like, your 9-to-5 job seems in the way. It feels too heavy. And then, as you said, an email that's supposed to be a 1 becomes a 5.
Yeah.
I genuinely never had a good concrete definition of burnout. Yeah. I never knew when I was burnt out. I genuinely thought it was a transient state of me not being myself, everything feeling desperate, and then I just needed to take some time off. And a lot of the time when I took time off, it didn't actually solve anything. It didn't solve anything. I came back and I'm still burnt out in the definition that you were saying to me. I genuinely feel like life's natural tendency is to make you burnt out. And you just have to find a way to literally just battle through it. And as I got older with age and I found better methods, the way you're defining burnout, I feel like I've gotten better at handling it. So I completely agree with you. I feel like life is genuinely is going to drive you towards burnt out. I
agree. And I think the difference is, because then some people will come up and say, well, you know what, my grandfather never complained of being burnt out. What I think the difference is that we're shifting now. One thing you need to appreciate sociologically what's happening to mankind. We're in the information age. We're sharing more. So there's a greater, our awareness of the human experience and what life is becoming more and more readily available for each other to learn from and to act upon, and our views on life are changing. What I think what burnout is finding out that this is a part of modern life, I think it was always there. I think even if it wasn't always there, because we can argue, was it always there, was it not always there? Even if it wasn't always there, I believe that's the age we're living in now, because, the complaints are known everywhere around the world. We can see burnout is becoming a major, major concern. And then even in the COVID pandemic, one thing that was discussed in terms of burnout was the impact of where do I work. That's why a lot of people started working from home, because they argue, hey, if it's going to reduce my feeling of burning out, Why shouldn't I work from home?
Correct. True.
You
True.
know?
That was one of the biggest questions that was asked at that time.
Yeah.
So just to quickly recap, do you think burnout is a purely emotional state?
I think it's you know, in all of medicine I say biopsychosocial. I think it affects all realms. I think it's something that biologically does take a toll. I think there's plenty of evidence to show that burnout does have a physical toll on a person and can lead to depression. If I may add, it can lead to mental health
Correct.
pathologies.
Absolutely.
Okay,
Yeah.
even if it's not defined as one right now.
Correct.
Socially, I'm going to speak from experience. I have been extremely irritable, and I apologize to everyone who's been around me. I have been a pain, and it's because I'm so burnt out. I'm tired, so it does have an impact on your relationships. And then you want to talk psychologically, well, it doesn't feel good.
And honestly, now you say that, I just look back at so many of my colleagues who are like, what's wrong with them? Why are they so moody? Why are they so irritable? Why are they always complaining? And just deep down, you just don't think, hey, maybe they are burnt out.
Yeah.
It's just such a weird topic that you genuinely don't know how to define who's burnt out, who's not. You can't pinpoint it.
Mm-hmm.
And there's literally no set criteria yet right now that helps you define what burnt out people is.
Yeah.
So Aziz, tell me about your experience. How did you get burnt out? Because I know you started your training year. As I said, you're juggling too many things, but you always seem like the guy who's got it under control. Seriously, if I ever felt burnt out, I'm like, yeah, Aziz Khayyat got it under control. It's like when you see this 30-year-old cancer patient and he's like got no risk factors, and you realize, wait, my life is not that bad.
Yeah.
I kind of look at you the same way. I'm like, bro, the guy's got 10 things on his table. He's not complaining about anything. Why? Like, I have no excuse
I don't know
to
why
not.
that made me laugh.
Honestly,
That got me.
why do I feel tired getting out of the bed if the guy is getting out of bed and doing all of this on his own? So just tell me, how did you find out that you were burnt out?
Well, it's a complicated answer. One thing is that there's an element of personality to it. You probably have noticed I'm type A personality. I'm not type B.
1,000,000%.
Yeah.
Yep.
I'm not laid back.
Yep.
I am not a laid back person.
Absolutely.
I discovered this in medical school because in medical school I worked on some non-medical projects, and I realized that while working those projects, this was maximizing my efficiency and my ability to engage in things. And I realized even though I was working more, I was feeling better. So this is how I understood my personality. So tying back to what you said, so inherent to my personality, I'm a bit of a workaholic of a person.
Correct.
Right?
Yep.
So this is already, let's call it a risk factor. This is already sending me down that road, right? Then let's take work for what it became in my life. And work has become, for me, a coping mechanism as well. Towards a lot of the stressors, without getting into details of things, when I get down about something, I throw myself into my work.
Correct.
I'm not saying this is a healthy coping mechanism.
Yeah,
I'm just saying it's mine.
I genuinely don't think it's a healthy
It's
coping
not
mechanism for my personality. And you said something insane.
I don't think for any. I think it's prone to hurt you. But it's something that I recognize in myself. I'm trying to improve.
I see.
But it's something I do recognize about myself. So then let's take just the sheer nature of medical practice. One of the problems one of the difficulties you'll face with practicing medicine is that the system is a little bit against you. How so? Always with burnout, when I was looking at a lot of these research articles about burnout, to cope with it, blah, 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 it would talk about, using your rest time to really rest, your weekends, like being mindful and doing this or doing that. Every 5 days, our biological clock gets flipped.
Is that an actual?
No, I'm saying that's what. That's
yeah.
on calls.
I get you. Like in medicine, yes, 1,000,000%. Yep.
So where's the recovery?
Yeah.
And then golden weekends.
Yeah.
That's once a month.
I know.
So the system is a little bit against you. I'm not trying to. This is not a criticism. This is just a comment on what's necessary. Is it possible to change the way we do medicine in that sense? I don't know. I won't be able. That's a question for healthcare management, not for me. But that in itself will make you more prone to burnout. So taking that schedule, taking my personality, okay, and then taking on the fact that I'm in a stage of my life where, and a lot of people who are entering their training years, this is a big turning point in my life.
Correct. And I'm glad that you said that, because we know for a fact that physicians within the first 5 years of their career, at the starting points of their career, they're much more prone to burnout than physicians who are well settled in or later in their career. So I'm glad that you mentioned that.
Absolutely.
So one of the most important things to me right now from this interview is to actually get a good definition that we can touch basically of what burnout is, because I think no one has a set definition, but from what you're saying is it's this cumulative effect that leads you to hating your job, basically.
Hating your job and then that leaks out into your life.
Correct. And that cumulative effect can be, sorry to talk over you, the cumulative effect can be a byproduct of personality, which I genuinely believe it, because my personality is very laid back. I think you've known me. I'm always having a laugh and stuff like that. So even when it gets stressful for me, I just let things go. But I know a lot of people, when you're like the doctor on steroids, that's literally what we call you, because you go the extra step every single time. So I think personality is a big one. Personality is a very big one. As you said, it's just other life stressors that can come in the way. That's another one. There's a lot of risk factors for burnout. So, and I'm glad that we're touching on them. So can you keep going about what literally just set the fuse? Okay, right now I'm 100% burnt out.
So
when did you, at what point in time in trainee year did you realize that you are burnt out?
So when I realized was recently when, I'm not sure if I said the story already or not.
You know, you did not.
No. Basically, I came home from a nap, from work, and I took a nap here in the office. I crashed on the couch, 20 minutes. I woke up from the nap so physically exhausted that I felt like I had the flu. I had myalgia. I felt sick. And I realized, I was like, what's going on with my body? You know, what is the toll that I'm putting on my body? Because something that should be restful made me exhausted. Okay. I was like, fine, what's the big deal with that? Then I kept looking into what else was going on. I was waking up in the morning stressed.
Okay.
That's a big one. My mom is traveling right now, so I call her in the mornings to just chat with her as I'm going to work because of time difference. So I call her, and I'm just angry. What happened? It's been 15 minutes of the day. What could I be angry about? No, I was angry every day. Okay. Then we go into work itself. I'm not able to, let's say I have some downtime to study. I can't bring myself to study. When I study, it takes me 2 hours to do a 1 hour job. I'm constantly behind.
Yep.
All these things put together, I realized, I was like, I'm burnt out. And I finally felt the effects. And it was recently. It was a few weeks ago, actually.
So honestly, just from my get is that there was a big event that happened. The day you woke up that you felt physically sick. And then you began to realize the few days afterwards that, okay, wait, I actually feel different. I'm not functioning on the same level. As you said in the beginning, you feel dysfunctional. You are genuinely dysfunctional. But do you think there were any warning signs preceding the day where you felt physically sick?
I think there was a few. I think more than warning signs, more so it would be, there was a few things that objectively, if you look from afar, you know, you'd kind of say, hey, that something doesn't make sense here. I'll give you a good example. Was I was chatting with someone about vacation. They asked me, have you taken a vacation in the past 1 year? And I said, no. And they went, you know, like legally in like the I don't know what the laws are in Kuwait, but like in Europe, for example, someone has to take some time off.
In a year?
In a year, there has to be some time for rest. And they have to.
Interesting.
You know? And so what does that tell you? That tells you that like this is needed. You know what I mean? It's kind of like saying someone telling you, hey, I haven't slept for 3 nights and I feel fine. You'll tell them, what? No, that's not okay.
Yeah.
It's a similar thing. If we look at vacation or vacation time as the sleep, you know, and the rest of your life as being, you know, the waking hours, then you kind of go, hey, why haven't you taken any time off in the past year? So that was a warning sign for me. One warning sign. Second was my inability to sit still. So I realized, no, really, I've always had that, but it's gotten to the point now where I have like a rota of like, okay, work, USMLE, doctor's brew, personal work,
that's
family
how
obligations.
That's how I see it, to be honest with you.
And that's how it goes. I had this like, what's going on? Like constantly I'm shifting, and I realized that I couldn't sit still. Like I can't even watch a TV show.
Yeah. Okay.
That's not okay.
So there's two things I always like to ask about these topics. One of them is this gets addressed a lot in Kuwait because of the shorter work hours. I know
Yeah.
we work from 7 to 1:30. We show up to work a bit earlier sometimes.
Yeah.
We leave significantly later. But the general consensus is that it's a 7 to 1:30.
Yeah.
When I tell a lot of the people who studied outside and who came from different countries, they were like, wait, you're burnt out? You have a part-time job. So what do you usually like to tell these people, honestly?
Well, the thing that I would argue with that is that there's two things to kind of say to that. First of all, you can look at it as one, we're all going to be burnt out regardless of the job you're doing. Eventually, you're going to hit a point of burnout because you do something for so long, so much, you just feel, you crash. So that's the first. So yes, okay, maybe if you argue that even if my hours are low, like, it's still inevitable.
It's still a thing. It's still something that's
still
gonna
a
happen.
thing.
So it nulls the subject,
Yeah.
voidless basically.
And the second thing that I would say is that it's subjective. Maybe if I go and work longer hours for a longer amount of time, I build a certain resilience, my output change, my
True.
personality changes. Because let's not forget, I remember when I was asking people about the subject, again, this is not based off any research papers, but subjectively, people were telling me, hey, you build up a tolerance. Your tolerance right now is different to a year from now and 2 years and 5 years.
Correct.
And so it's all subjective. Okay, right now I'm feeling this way. Maybe it will change. Maybe I'm going to build up. So I think that it's unfair to say because of our hours that instantly, like, we're not deserving of being burnt out. Hey, man, I could be working half your time, and if I feel burnt out, I'm still burnt out. Sorry. Like,
Yeah.
it doesn't make me less of a human being or a
Exactly.
doctor.
Exactly. I completely agree with that. And just to further add to that, I think it's personal. I think
Yeah.
it's individual on an individual level. I'm one of those people who kind of likes the weekend, but also kind of hates the weekend. I like the weekend because I get to go out with friends, do the stuff that I couldn't do throughout the week.
Yeah.
But I hate Saturdays nights because I'm like, okay, now I have to go back to that schedule of waking up in the same day.
I feel you.
So I've realized in those weeks where I've actually worked the whole week and then I continue throughout the next week, I do feel physically more tired, but I'm a bit happier. So I'm not saying I'm a workaholic. It's just with the shorter work hours, I think it depends on the individual. But as you said, the natural inclination is that we're all going to get burnt out at some point in our lives. It's about how we deal with it.
Absolutely.
And whether we understand the subject or not.
And let's not forget something.
Yep.
The shorter work hours also means that people free up time to do other things. So they're working on other stuff. Like, maybe if I had longer work hours, I would have never started the Doctor's Brew. I'm still working, aren't I?
Yeah, fair enough.
So that's
fair
another
enough.
point.
But another argument is like, wait, why are you bringing more stress on yourself and then complaining
Well,
about
that's just
burnout? So there's it's. So my point is not like to go into about okay, well, how did you get into this? It's just
Yeah.
about how do you deal with burnout? How do you identify it? How are you gonna deal with it? The other thing is we talked about a bit about pathologies in itself.
Yeah.
A lot of people like to bring the subject of dopamine. It's just like, okay, you've been doing the same routine over and over and over again. Your dopamine drops, and now you're bored. What do you tell people who are just like, bro, you're just bored. That's what's happening. That's why you feel tired. You're physically ill. You're doing the same thing over and over and over again, despite being bored and tired. How do you respond to these people? Because I genuinely know a lot of people who are like, burnout is not a real thing. It's just a dopamine issue.
Well, so there's two things. There's you're bringing up a topic of labeling, and then there's also the biological component of it. So if we take about the dopamine thing, well, in that case, if we're gonna dumb everything down to just a bunch of neurotransmitters, then there's no such thing as love in this world. You don't love your child. You're just
You're just a biological creature, basically.
Exactly.
That's what we're saying.
And if that's the case, and you wanna, and that's your worldview, you're entitled to it. But inherently, I can't argue with that because that's not my worldview. And I would say that most of the evidence suggests that that's not actually reality. Otherwise, there would be no such thing as a biopsychosocial model. There would just be bio.
Exactly. Because the reason I bring this up is a lot of people think burnout is not a real thing. And as you're saying, no, it is an actual real thing.
It's absolutely
And I
real.
completely agree with you. I think burnout is a real thing. It's not just a biological
No.
state of mind that's supposed to just be a function of a couple of neurotransmitters.
And then what you mentioned about being bored, that's just labeling. You can call it whatever. You can call it being happy. I don't care. If the effect is the effect that we're seeing, it's bad.
And I love that you mentioned that because
Yeah.
my primary objective of this was defining burnout, identifying burnout, call it whatever you want to call it Barbie, call it boredom, call it burnout, call it whatever you call it. My goal is to identify it, and how do we deal with it? So
Yeah.
before we actually tackle a couple of methods that you've used and what the evidence says to do,
Yeah.
so just tell me, what do you think are some of the harmful consequences of burnout? So let's talk about a personal level. What does burnout do to you?
I think on a personal level, what it puts you at risk of damaging your mental health and putting you on the road to pathology. That's just for sure.
For sure. And I'm
That's
sure we've
one.
both seen people who suffered from burnout and then actually transitioned towards depression or some other
100%. So that on a personal level, it does that. And then I also want to comment on it on a philosophical level.
Oh yeah.
Sorry.
Oh, my cup of tea. Come on, go for it. Just say it.
Your cup of coffee.
My cup of coffee. My
Your
bad.
cup of coffee. Philosophically, what is the meaning or purpose of existence? You know what I mean?
Oh yeah,
And-
that's too deep, man. Okay.
If we just give a simple, vague answer to it, which is to live, the purpose of life is to live life and to exist, by that alone, I think burnout stops you from just living life, because life is not exclusively just working. I think there is something more profound to life. Life is a holistic experience. And what I think burnout does is that it limits your ability to engage in that
I
experience.
absolutely love that.
And you only get one shot at this. You're not doing this twice.
Yep.
You can do your job twice, and you can do that exam twice. You're not going to do life twice.
And I think what you just said is one of the key symptoms of burnout, which is depersonalization.
Absolutely.
Dissociation from reality,
Yeah.
basically. I genuinely do think what you just said right now is a philosophical definition of depersonalization, which is
really is,
absolutely
yeah.
true. It literally robs you of the experience of actual true life. So on a personal level, as you said, it can shift you towards mental health issues.
Yeah.
What do you think it does to the people around you, family-wise? Let's say family and friends. What do you think burnout does to you?
I think number one, it does contribute to alienation.
Correct.
For
100%.
sure. How are you going to maintain relationships with people if you're just working all the time?
Correct.
It's impossible. The math doesn't work there.
Yep.
So yeah, definitely, from a social side, that it leads to a bit of alienation, but also I think it makes you less able and less. The word is not just you're not able to because of time not engage in these relationships, but also we have let's call it bars of energy. You know what I
Okay,
mean?
Yep.
How, if you're drained after work more than you usually are, how are you going to tend to relationships? Because these things are not perfect. So let's say someone who has kids, for example, every day is not going to be just, I'm so happy sitting here with my kids. Sometimes you got to deal with your children's problems. You need to deal with people's problems. And if you don't have the energy to deal with it, what does that do to the relationship?
Absolutely. I completely agree with you. And I think what you're trying to say is that there's a baseline level of energy, and over time through burnout, your baseline drops.
Yeah.
And basically everything else becomes a chore. Yeah. And the reason why I want you to tell me these things, because I think what we're doing right now is we're highlighting some of the symptoms of burnout. One of them is depersonalization, which basically means not being able to live life while living it. You don't feel like you're living.
Yeah.
You actually feel being robbed of the sense of pleasures that you usually have.
Yeah.
Secondly is always feeling tired.
Yeah.
You do feel like your social connections, the chores that were once chores that you were like, meh, I can do this, now feel like overwhelming burdens.
Yes.
So what else do you think that does to your hobbies? And just do you think people destroy families because of burnout without realizing it?
I think, I don't know if I would say destroy families from burnout, but I think that there's an element to it, because also if you're a workaholic and you don't tend to these relationships, there are plenty of families that disintegrate over this. I think what burnout does is that it hurts you. It can contribute because it will hurt these relationships if someone doesn't take steps to address them.
Absolutely.
Yeah.
And that's a massive point. And the key step to addressing it is to recognize it. How
Yeah.
do you address something without recognizing it?
Absolutely.
So we talked about some of the personal issues. For
Yeah.
me, sleep is one of the most paramount factors to help with burnout. It's a major risk factor with burnout. And one of the biggest risk factors actually are treatment modalities to fix burnout. It's a good night's sleep.
Yeah.
That's one of the things that I also want to get your opinion on. But before that, we talked about personal consequences. Tell me about the professional consequences. And I know there's a lot of literature around this, and I know you're a massive advocate of mental health just because of this topic. So I'm just going to give you a few minutes, get it all off your chest, because this is such a massive impact and such a... I just can't...
Well,
yeah, go for it.
if you feel like everything you're doing is a mountain, even if it's nothing, even if it's just an email, even if it's just listen to this patient's chest, your quality of work will go down. Eventually, also your quantity. You know what I mean?
Yep.
And this is, I'm sorry, people who say, nope, that's not going to happen, it's fact.
We know, literature-wise, we know that.
Yeah, you're
100%.
not, because you're not a machine, you're a human being.
Correct.
You know what I mean?
Yep.
And even machines need tune-ups, you know?
Yep.
So the quality and quantity of your work will suffer, for sure. Now, what's the problem with that in our profession?
Correct. In our profession. Go for it.
People's lives become at risk.
Yep.
You make silly mistakes that shouldn't happen. Like you write to your notes are not as good. You double prescribe something. Okay, let's say I wrote paracetamol twice on a prescription chart. Nobody's gonna die over that because obviously you only give it once.
Correct.
Right? And of course there are layers in place in hospitals to safeguard. So there's nurses, whatever. But you can make other mistakes that are huge.
Absolutely.
Yep.
So
when you don't take care of yourself from the side of burnout, you need to be aware that you have responsibility to do so because there's patients who can be impacted
absolutely.
By your poor quality of work.
Absolutely.
There's something really important to bear in mind, because we feel guilty. It's very natural to feel guilty taking time off work. Very natural. Even medical, non-medical, it's a natural feeling.
I agree with you.
But when you realize that it's a responsibility to do so, because of the fact that your work has implications on people's health, that makes the guilt a bit easier. It really does.
Yeah, and I completely agree with that wholeheartedly. And I feel like I wish the hospital systems would understand that a burnt-out physician is such a dangerous physician. Absolutely. To his environment, to his patients, he's much more prone to error. His reaction time is lower. His quality of work is lower. Mm-hmm. The way he works around his team is significantly worse than his usual.
Yeah.
And for people who care about money, I'm 100% sure, and I think the literature has highlighted that a burnt-out physician is much more costly on a hospital than an efficient physician. Just because of the mistakes, their work output, their efficiency, and all of these matters. This is why it's such a massive topic that needs to be talked about, especially in the healthcare settings where we're dealing with people's lives.
Yeah.
So 100% agree with you. This is why burnout gets so much attention. Now, I know a lot of the time we heard of really sad cases of what burnt out has led to, especially when it's undealt with. Before I transition into some of the things we can do to deal with burnout, do you think in Kuwait we have anything going on for us towards tackling burnout?
I think I can sit here and criticize and poke holes all day, and this can be not just Kuwait, just anywhere. But what I think our issue is in Kuwait, not necessarily the system, but more so that on a personal level, we need to take more responsibility for addressing our burnout.
Personal level.
On a personal, I think listen, even if we finish our work early. Compared to other places in the world, 1:30. We also, like in terms of vacation time, we have plenty of good vacation time.
Correct.
But they can give us 6 months of vacation, but if it's not used properly and there's no awareness on it, then we did nothing.
Absolutely. And especially with the way we get vacations, basically it's not like, hey, I need a vacation now. And you're like, no, we actually don't have enough doctors. How about you take a vacation in 4 months? I'm like, bro, I need it now, that. So that's one.
But there are things that, again, but this is why it comes down to the individual, because sure, let's say your team can't afford you leaving now. What do you do then? You can't just at any whim be like, I can't do this. And you can't get to the point that you're so burnt out you can't work, because that's just bad for everybody.
Correct. Absolutely.
So the best approach for burnout, and this is why when you ask me like, what's our issue in Kuwait, I think our issue in Kuwait is us ourselves. We're not reflecting on it enough. And we're not addressing it internally because it's a preventative rather than reactive, thing.
I absolutely love that. And that I felt that is such a key distinguishing feature between Kuwait and the US.
Yeah.
In the US, when we used to get burnout talks about 4 times a semester in every single med school year. And it was always the same thing. We were telling them we don't have enough time. You guys are giving us 6 hours of lectures and we can't keep up with the lectures. And on top of that, we have USMLEs. And you guys are telling us, take some time off. Go to the gym. Go meditate. Go out with friends. And we're like, we can't do that.
We don't have time,
In Kuwait, we do have the liberty of getting shorter work hours. We have more liberty. I feel like, as you said, a lot of it is personal.
It is.
A lot of it is we're not reflecting. I'm not saying the system is deprived of any fault.
Yeah.
there's plenty of faults in the system in Kuwait, and I do think Kuwait is doing, just inherently, Kuwait has a better system of dealing with burnout than the US.
Because there's more space for
Correct.
it to
Correct.
you know, vacation,
to do
rest.
other stuff.
Yeah.
Correct. I completely
Absolutely.
agree with you. So Aziz, you've been burnt out. What have you done about it?
Well, first of all, what I've done is I've been very reflective. This was step one. This is a big thing.
Absolutely. Yep.
You mentioned very, very aptly. If you are not able to recognize it, you can't be able to treat it, you know?
Yep.
So my first step with burnout is being very reflective about it. And the second thing that I have, I'm very fortunate about to have this, is that I have a very strong support system. I have a lot of people around me to whom I've been able to go discuss my issues with, seek advice here and there. Now, my issue currently with dealing with burnout is that still I feel I'm nervous being taken away from my work. It is, I cannot explain to you enough. It is not a good feeling. I don't like it, but I'm pushing, you know. Now, the thing that I did, the main thing that I then did to deal with this burnout is that I took a step back and I put things in place that will force me to step away for a bit.
Okay.
So, for example, for the doctor's brew, I turned to my team and I said, listen, guys, we have 2 weeks. I want everything recorded within these 2 weeks because I'm going to disappear after this for a vacation and I don't want anyone to talk to me about this. I'm not going to address any questions. I'm not going to record anything. I'm going to do everything you want me to record right now. So I told my team, listen, you make a list of what you need my face for, and I'll do it. You know? And it's these 2 weeks. And so that's you know, that's one step. That's one step. I forced myself to take a vacation, so I went and applied for a vacation between rotations. Again, I do not want to take a vacation. This is horrible for me.
Yep.
But I need it.
Yep, I understand that. And why do you think that guilt exists, especially within medicine? Because I've never taken a vacation in medicine so far for the sole reason, exactly what you're saying. Whenever I think about taking a day off in medicine, I feel incredibly guilty. I don't know why that is.
I think it's because inherent to our profession, it's a very, how can I put it? It engulfs you. You know what I mean?
Correct, but on a conscious level, it's not like I feel like I'm letting my patients down, you know? Maybe on a subconscious level, I do feel that way.
Well, I mean, don't forget, you just graduated med school, right?
Correct, yeah,
So
absolutely.
if you look at what was your life like in medical school, okay, fine. You went in for lectures from 9 to 1 p.m. And then from 1 to 9 p.m., did you just relax?
Absolutely not.
You were just sitting there studying all day. And if you weren't studying, you'd socialize, and then you'd probably be talking about medicine as you're socializing because they're probably your medical friends. So medicine sucks your life.
Yep.
So it's not surprising that now, after you've graduated, you still feel sucked. And that's you know, me, for example, that's how I feel. It's like, it's not a surprise that I feel so with medicine. Look, it's what time is it right now? It's 8 p.m.
Yep.
And I'm in scrubs.
Yeah, I completely agree with you. Yep, I completely agree with you. There's one topic that I always like to get other people's opinions on. In the US, based on what you're saying, and I'm 100% sure I felt burnt out, is the fact I could never have a social support system. And I'm 100% keen on the fact that a social support is one of the highest impact things that you can have around you to help resolve burnout. What do you say to those people who are burnt out? Just like in my situation, when I was in Michigan, it was snowing. It was dark for about 17 hours of the day. There's no sunlight. There's no family around me. I couldn't go to my family. What do you tell these people, these students, these doctors there who have no social support around them?
Invest in making one. And it might take time, it might take effort, and it might not be a linear overnight thing, but invest in it. So I remember, this reminds me of when I was first in the UK. There's some people around me that said, you know, the way that I view university here in the UK is that my life is in Kuwait and I'm here just to get a degree and I'm just going to leave. And I said, well, that's not a way to live. You're still living here for 5 years. You're not exactly putting your life on pause and then going back, you know? Yeah. So go invest in it. Okay, you don't have too many friends that you feel comfortable with, whatever. Try to go meet new people, even if it's at the sacrifice of work or whatever, because you're not going to get that work done unless you have that good support system.
Yep.
You know, it's essential to do these things. And again, let's go back to what I was saying. You gotta be a human being. You gotta live life, and life is not lived alone.
And do you think, first things first, I completely agree with that one wholeheartedly. Do you think talking to a therapist, does that constitute a social support system?
No, it is not a social
So
support system.
because that's why I love bringing that
No,
topic up with you. Because
Yeah.
for me, my answer to that question would have
Yeah.
been, go talk to a therapist. Don't find a social support. You don't have the time to do that.
No, that's totally different.
So
That-
can you further elaborate on that? Because that was my
Mm.
recommendation whenever I was asked, like, I don't have anyone with me. I'm like, I never told them. I'm just like, bro, just go Google a therapist and talk
Yeah.
to them. That was my natural inclination.
If I may say, this is maybe based off this view that a lot of people have, that a therapist is essentially just a friend you pay for.
Correct. That's my thought process too.
Well,
honestly.
that's not a therapist. The way that the way that I like to describe.
I love how you said that. Yeah. Okay.
If you go to the gym,
Yeah.
okay, انت رايح oxygen خيي, okay,
Yeah.
and a trainer comes up to you and says, hey, I can run through your routine today, comment on your what's it called, your form, I can tell you about your diet to maximize your growth, blah 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 blah. If this guy comes, tells you that, and if you bump into me and I start telling you that, is it the same?
Yeah, absolutely. I love the way you articulated that. I genuinely think
Someone
that was
came and
brilliant.
has lived their trained and studied, you know. And the thing is, the therapist is not trying to be a friend. A friend's role in conversation. If you feel like your therapist is your friend, you might need to find another therapist. Because,
Really?
Yeah,
Okay.
yeah, for sure. Because a friend takes on a different role. Friends cast judgment, for example. You know, you go to your therapist, you vent and you say, and then you try to piece together and understand. If you complain about a friend to your therapist, you say, oh, I hate that person. Your therapist is not going to sit there like, yeah, you know what? They suck. I hate them.
Yeah.
You know, but your friend might. And you need that also. That's a different need, you know. The needs that a therapist fulfills is not that of a friend.
Absolutely. So just to further go into that, when do you think someone should seek a therapist? So just to
Anytime.
quickly-
Anytime. No, this is one thing. I am totally against this notion of I need to go to a therapist when I am sick.
For me, it was a therapist was a last resort. Like
Yeah.
basically, I fixed my sleep schedule. I
Yeah.
got plenty more sleep. I exercise, and I highly recommend. I exercise every single day.
Yeah.
I do cardio. I do weightlifting. I feel like it improves my mood. I've
Yeah.
seen a lot of people who have such negative affects or depressive affects who just significantly
Well, you know,
light
that's
up.
one thing I started doing for my burnout is I started exercising more.
They light up.
Yeah.
People light up. So
It's
that's
huge.
another thing.
Yeah.
And then eating more, socializing more, like
Yeah.
because a lot of people who get like burnt out, they either overeat or undereat. So if you undereat, please eat more. So if you overeat, probably eat less. But one more thing is, I always had the notion that once you deplete all of the options, you don't know what to do, then you speak to a therapist. You disagree with that?
I totally disagree. More and more we see how the human experience is extremely complicated and prone. Childhood is trauma by all psychological definitions.
I love
People
that.
come out of childhood traumatized, and that doesn't mean that you had a bad childhood. No,
Wait,
no.
Is this Freud or is this is Aziz Khayyat?
This is if you want to go into psychoanalysis, truly, and because it's not because you had a bad parent that you have a bad, your childhood is bad. No, it's not that. It's the fact that this is the human experience. Now, if you have the ability to be with a professional that can help piece together the way you think, try to maximize your enjoyment out of life, maximize your relationship, and just understand, everybody feels like they have everybody seeks mentors and things.
Correct.
I don't understand why we still have this thing that the mind doesn't need a mentor, and it doesn't need to be when the mind is broken.
I love that. I absolutely believe that. Yeah. And as you said, not when the mind is broken.
No.
You can have one throughout life.
Absolutely.
What do you think about this statement that recognizing burnout helps with burnout?
I think it lightens the load by a lot because
Correct.
there's a big fear when you're just like, what's going on with me? Why am I this way?
Correct, because you understand it, right?
You understand
and
it, yes.
and I genuinely believe that recognizing that you're burnt out makes you forgive yourself for so much more. It helps ease.
In my case, no, but yes, most people, yes.
Completely. Type A's are different, bro. I completely agree with you. So we talked about sleep. We talked about talking to a therapist. We talked about a good social support, about diet. Any other things that you can think of that can help with burnout, along with recognition that you are burnt out? What do you think about telling your team that you feel burnt out? Do you think that's heavily stigmatized? I genuinely think in Kuwait it is stigmatized.
Even if it's stigmatized, you say it. We need to be the change. Sorry, like if someone doesn't understand it, then too bad.
It's just I know the reactions. Like, what do you want us to do about it? You know, like when you tell your team, like, should I clap for you?
You'd be shocked. I've told my team, and they've come to me and said, "Hey, how can I help?"
Really?
Yes. Okay. So I've had people come up to me and say, "Hey, we'll help you if you need a study buddy. Do you need this?" If your team can't take you saying, "Hey, I feel burnt out," then you know what, you gotta reflect on what team you're working with.
I'm actually so proud of what you're saying right now, and just to think back at it, I think it's just outside of medicine, especially in Kuwait, where burnout is not talked about enough. I feel like my parents have been burnt out for a very long time. They just don't say it, and I'm pretty sure a lot of people who are burnt out. They don't, and I think my parents don't say anything because they've learned to just swallow their pride.
Yeah.
Glorified work culture.
Yeah.
Basically, my mom yesterday was like, "Hey, I don't want to do this. I've been so tired of just like fixing the basement and stuff like that." Yeah. And she still goes and does it, and she feels miserable. She doesn't know how to dissociate with it. And then if I bring the topic of burnout, I feel like she doesn't really understand the topic. So, any final words before we actually wrap this conversation? Because I think we hit the key points of this conversation, which is defining burnout, the importance of recognizing burnout. We've highlighted what burnout does to a society and the individual, and what are some of the things that we can do to tackle burnout. Anything else you think you want to highlight? Because I know you specifically wanted to talk about this for its mental health impact and the month that we're in. So can you tell us more about the month that we're in right now?
I just meant the month as in like because it's had an impact on me in this month. The same.
Correct, but is it career kickstart month, right?
Oh wait, you mean in that way?
Yeah.
Sorry, that's the whole season. As in like, the reason that I wanted to talk about this now was because our topic has been starting off your medical career, and you know what? We said it. Preventing burnout is better than responding to it.
Absolutely.
So if you can put little things in place to, number one, recognize burnout, and number two, do things to prevent it. So like create a work-life balance, have a good social network. And there's one thing I do want to say to a lot of people. A lot of people, in terms of mental health stuff, there's something I always hear a lot of people tell me. If, let's say, someone is feeling down or for whatever, and I tell them do X thing based off the research, they say, "Oh, this doesn't work for me."
Yep. I'm one of those people, by the way.
I know. Now, the thing that my response to that is, do it anyways. If the evidence suggests that if you took 1,000 people and you did these few things, that it will make them better, just do those things even if it doesn't feel good. So, for example, exercise. Some people will tell you, "Oh, well, exercise hasn't been making me happy." Still go exercise, because if you know objectively, the science tells us that exercising helps with burnout, helps with feeling depressed. Just do it anyways. Because chances are, long enough time, it's gonna pan out. I see.
Because that was my objection to your question. Like, aren't we supposed to select what works for us, what doesn't work for us?
For sure. But eventually, you find out.
Correct.
But give it a fair chance.
And I completely agree with you. I think people underestimate a lot of the literature. They don't apply it fully. Yeah. It's like, okay, this is supposed to be a quick fix. I don't think there exists a quick fix, as you're saying.
No, there isn't.
You're supposed to take it.
There isn't.
And I think we need to talk a lot to a lot of the new emerging physicians and new healthcare workers that you guys are the most susceptible population, as well as the elderly population, like our consultants lay down the line, basically. That you guys are very vulnerable population. You really need to be aware of this and have a read about the literature. What does the literature say about burnout? Who does it impact the most? What can you do about it? So I completely agree with everything you've said. I think we had a phenomenal discussion about the topic.
Thank you so much for hosting.
Honestly, you're a wonderful, host, and you're a wonderful guest at the same time. And as I said, Aziz, you're a doctor on steroids. I'm really sorry that you're going through burnout, and I'm glad that you're getting a vacation soon. Hopefully, you feel significantly better once you're coming back. And again, thanks for the help for sponsoring us with the coffee. I genuinely think, if you look at the way we talk, within the first few minutes, we're like, we're still getting there. Once the coffee kicks in, we get so much better. So thank you for being with me, Dr. Aziz. And until next time.
Will you allow me to sign us off?
Sign us off, please.
That's the last sip of coffee for the day. A special thank you to our host, not our guest this time, our host. Thank you for stepping in and doing this episode. Tune in for more.
My pleasure.
Hope you all enjoyed this episode of The Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.